Welcome back, everyone. There is a confirmed case of the measles here in Connecticut, and the Department of Public Health says a child in Fairfield County contracted the disease. The child was not vaccinated and was infected while traveling internationally. But there are obviously some concerns here about the measles spreading. So to get parents the answers they need to keep their family safe, we are talking to Dr. John Schreiber, who specializes in pediatric infectious diseases at Connecticut Children's. Dr. Schreiber, thank you so much for being with us.
Thanks for having me.
So first off, let's talk about the basics here. How contagious is the measles? How does it spread? Is it treatable?
Well, measles is a virus unique to humans, and actually it's the most contagious of the viruses that we know. It's much more contagious than COVID. So about 90% of the people who are not immune exposed to a case will get measles. However, we have a great vaccine, the MMR vaccine, and that vaccine, after 2 doses, protects almost everyone from getting measles. So we have an outstanding vaccine, but it is a very contagious disease for those who are not immunized.
How does it spread, doctor?
It spreads by touching objects and also airborne. So the virus can get in the air and you'll breathe it in. Also by touching objects the infected person has also touched.
If you do happen to contract the disease, is it something that's treatable?
Well, measles in the old days before the vaccine actually was a very serious viral illness of children. Many of them ended up in the hospital. A number of them would get encephalitis, and there was a significant death rate from measles. So the vaccine in this country has almost eradicated the disease, and we don't see very much, but it is a very serious infection. Immunization prevents it, and it's 2 doses of the MMR vaccine, or the MMRV vaccine is also used. And that provides very, very substantial protection. But if you are exposed to a case of measles and you don't know whether you've had the vaccine, or you know that you haven't had the vaccine, then you'll need to get a booster dose. You get a shot right away, and that will usually protect you from getting measles if you are exposed.
Likely the majority of people watching right now have been vaccinated. They probably have had their children or their grandchildren vaccinated. If that is the case, can you still contract the measles?
If you've had 2 doses, it would be very unusual. However, if you've had 1 dose of the vaccine at 12 months and you haven't had your 2nd dose yet, it is possible to contract the measles. Also, elderly who were born before 1957 have usually been exposed. It was before the vaccine era, and we presume that most of them are immune to measles as well. But you need those 2 doses. If you've only had 1 dose, you're probably not immune yet. If you've had 2 doses, you're probably in good shape.
All right, good to know. A lot of good information there. Dr. John Schreiber with Connecticut Children's. Thank you so much for sharing your expertise with us. We appreciate it.